many causes of testicular pain in babies and older boys, and most of these cases do not require urgent management. However, the one most serious condition we must look out for is testicular torsion. Testicular torsion usually presents with acute onset, rather severe testicular pain, which sometimes could be associated with tummy pain and vomiting. There often is redness or swelling to look at, but not always. Therefore, if a child has severe sudden onset testicular pain, he must be seen in the closest A&E as soon as possible. Testicular torsion is where a testicle twists on its pedicle. The pedicle is the blood supply that comes from the tummy. It is made up of an artery and a number of veins. And the testicle can literally twist around this pedicle and block off its own blood supply. Therefore, if we do not diagnose and operate on a testicular torsion within 6 hours of the onset of pain, the child could lose their testicle. Therefore, once again, please, whenever a boy has acute onset, severe testicular pain, please get them seen as soon as possible. Sometimes when we do a scrotal exploration, which is where we actually perform an operation to check that the testicle is contorted, we might find other causes for the pain. Other causes include an infection, sometimes called an epididymitis or an epididymo-orchitis. And sometimes there's a more minor condition called a torsion of the appendix of the testes. This is a little cyst that sits on top of the testicle and can also twist and give very similar symptoms, but is not as severe or urgent as a testicular torsion. It is very difficult for any specialist to differentiate between a full testicular torsion and an infection or another cause. And we will most likely recommend the scrotal exploration just to make sure that we are not missing a testicular torsion. Ultrasounds are very unreliable in this situation and sometimes only cause further delay. So again, we wouldn't normally recommend investigation for these conditions. There are other causes of testicular pain which may be less severe or less urgent. A common cause in teenage boys is a condition called a varicocele. A varicocele is a dilatation or a swelling of the veins surrounding the testicle, usually on the left-hand side. Boys might notice it because it has an odd appearance. It looks a little bit like a bag of worms. Or they might notice a dragging or uncomfortable sensation during sport. It is always best for this condition to be checked by a paediatric urologist. We will assess the child for any symptoms. We will also request a scan, in particular looking for testicular volumes. A varicocele could affect the growth of the testicle on the same side. And if we notice that this is happening, we may recommend surgical treatment. There are various options, and most of these are nowadays minimally invasive. Other causes of testicular discomfort could be small cysts. These are called epididymal cysts and do not normally require surgical treatment. They are very commonly seen on ultrasound scans. Very rarely we could find testicular tumors or lesions. These are very uncommon in babies and children, but do happen. And therefore, if you see anything abnormal or feel any lumps in your child's testicles, please do consult us and we will perform an ultrasound scan to check.